Garmargaret Lascaherlick, and Minister, welcome, and I commend you for your work. I suppose, Minister, the welfare of people is important to us as a collective, but also individually. And I think the important point that we can all make today is that there is significant investment, and there is a need, I think, that Senator Mullen rightly said, is to teach an element of resilience to people. But in saying that, Minister, I want to ask for your cooperation in the need for us as a Parliament and as a government to legislate for mental health training in the workplace. I'm struck by the fact that we don't sometimes talk about mental health, and I commend Senator Black for her work and bringing that conversation, that core in terms of the need for mental health to be prioritised. And I would say to you, Minister, there is a need now for us as a government to consider, and I'll work with you to bring legislation forward to bring mental health training for employees into the workplace, something I believe is essential for the well-being of the workplace. And if you take the hierarchy of Maslow to reach self-actualisation, I think this will be a key component part of our new workplace relations post-pandemic. We know anecdotally about the effects that COVID has had on people. The pandemic has highlighted more than ever that we must prioritise the promotion and the nurturing of positive mental health in the workplace. And we have all stories that tell us about what's happening to people in their mental health. I'm struck about, Glenn Close's great quote when she says, what mental health needs is more sunlight, more candour, more unashamed conversation. And we must put a value on health and safety in the workplace, which we do. And I think the whole issue of mental health training is one that we can work to achieve and to bring about better awareness, which will become the norm for people. And we talk about putting in resources, and we are putting in a huge amount of resources into mental health in a variety of ways. But, Minister, I would make the point to you that we should, and I would ask you today to go back to Minister Chambers and speak to the sporting organisations across the country. There's a group of young people from minor 17 or 18 years of age down that can be training in pods of 15, whether it's soccer or hurling or football or rugby or whatever sport. They can be training in pods. We all know sports complexes where there's acres of ground, where young people can train safely in pucking a ball or kicking a ball around to each other. It doesn't have to be organised matches, but young people are frustrated in this lockdown because they have lost that sense of hope. That vision of the summer of playing games has been taken away from them now. And I would appeal to government. This won't, in my humble opinion, add to COVID-19 statistics. This will improve and bring a surge in positive mental health. And I see it in my own county and city. There are young people in the green where we live, out kicking ball, out training in the greens. And they can do so safely in their GA or soccer rugby clubs. And I would ask that we would give consideration to that. Minister, we have spent billions as a state on mental health. And what we must do now is to ensure that the current challenges that we face have a positive impact on people. Linda Poindexter always said, one small crack doesn't mean that you're broken. It means that you're put to the test and you didn't fall apart. And we must learn as a nation, as a collective, that we can together work to help each other. And I commend the work of Senator Black and her group. I commend your work, Minister, and I conclude in this. You have an enormous task ahead of you, but your compassion and your personal sincerity will win through, as it will with Minister Feehan with you. But I thank you for being here today, and I thank you, Lascaherlick.